The rising prevalence of diabetes. A global health crisis. Diabetes is rapidly becoming one of the most critical health issues worldwide. With its prevalence on the rise, especially in developing countries, this chronic condition is creating a substantial burden on healthcare systems and affecting millions of lives. But what is driving this surge, and how can we take action to manage it? The scope of the problem. The International Diabetes Federation estimates that over 537 million adults were living with diabetes in 2021. This number is expected to rise to 643 million by 2030, and a staggering 783 million by 2045 if no significant preventive measures are taken. This growing epidemic affects people of all ages and economic backgrounds, although low and middle-income countries bear the brunt of the disease burden. Factors driving the increase. Several factors contribute to the rising prevalence of diabetes, particularly type 2 diabetes. Sedentary lifestyles. Modern lifestyles that promote less physical activity and more sedentary behaviors are major contributors. Unhealthy diets. Increased consumption of processed foods, sugary beverages, and high-fat diets are linked to higher rates of obesity, a significant risk factor for type 2 diabetes. Urbanization. Urbanization brings lifestyle changes, including increased access to fast food, less physical labor, and reduced opportunities for exercise. Aging population. As people live longer, the prevalence of age-related chronic conditions like diabetes is naturally increasing. The global impact. The consequences of the diabetes epidemic are not just medical but also economic. Healthcare costs related to diabetes are skyrocketing, with global diabetes-related healthcare spending reaching $966 billion in 2021. Diabetes also increases the risk of complications such as cardiovascular disease, kidney failure, blindness, and amputations, further straining healthcare resources. Prevention and control strategies. While diabetes is a global challenge, it is preventable and manageable. Healthy eating and active lifestyles. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, alongside regular exercise, can help prevent or delay the onset of type 2 diabetes. Public awareness campaigns. Governments and health organizations are raising awareness through programs aimed at educating the public about the risks and management of diabetes. Early detection and monitoring. Regular screenings for high blood sugar levels can identify people at risk and ensure early intervention. Technology in diabetes care. Continuous glucose monitoring, CGM, devices and telemedicine apps are revolutionizing diabetes management, allowing for better monitoring and control. The rising prevalence of diabetes is a global health crisis that demands urgent action. By addressing the key risk factors and promoting healthier lifestyles, we can curb this epidemic and improve outcomes for millions of people around the world. Together, we can combat diabetes and its devastating effects. If you or someone you know is at risk of diabetes, talk to your healthcare provider about early detection and preventive measures. Make lifestyle changes now to reduce the risk and manage diabetes effectively. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content.